fibula bone. All right. So we go back. So if we go back here, I want to kind of start from right about here. So the head of the fibula is very easily it's very easy to palpate. You can feel it. You can actually feel your own if you just palpate on the outside. So it's very easy to palpate the head of the fibula. The tibial tuberosity is also easy to palpate either. So what I want to do is just drop right in between here. And then I'll just have them dorsiflex. And you see my thumb elevate, go back down, plantar flexion. Dorsiflex, you see it lifts up my thumb. So you have a nice area to work with the tibialis anterior. And then we also, if he goes ahead and invert the lower foot. So now he's inverting it, evert it, and invert it. So I can feel it pop underneath my thumb. So there's a big difference from him inverting and everting the foot versus him inverting and everting the tibia versus him inverting and everting the femur. So I see a lot of students mess that up. They will be like invert the foot and then the whole entire leg inverts. All right? Or they might say invert the tibia. Tibia cannot invert or evert unless the knee is flexed. So there's no way you can get inversion on a straight leg. The knee has to be flexed. All right. So if I want him to invert the foot, I'm just going to stabilize the tibia and go ahead and evert and invert again. Yeah. So it's popping out underneath my foot, my thumb. Oh, much better. All right, so here, see I'm in my stance. So working this muscle, this is one of the ones where that thumb is going to be on that island for this treatment. But then also I'm using my index finger and my middle finger to strip that area. So you'll see here, thumb. You'll see here, you see how I kind of curve. And what I'm doing here, I'm actually putting his foot into inversion so I can strip it. Or if I want to add there's a term of active stripping where your client is actively doing the movement and you're stripping the muscle while they're doing it. So it's twofold. You're getting a stripping and they're actively moving that muscle. That's a quicker way to get a release in that muscle. So as you'll see here, as I'm going up, so I'm going up from the insertion to the origin. I'll have him go ahead and dorsiflex. Come up, I work that area. Coming off on the tibia, plantar flex, dorsiflex. So I'm stripping the muscle during the contraction of that muscle. So when he's contracting it, I'm stripping it. So that's more of an intense work. Yes. So I get a couple of those in, but then I can have him relax it. And even this, he's probably feeling a little bit of work in that area. So all I'm doing is I'm coming up, I'm getting in between. Once I feel the head of the fibula, or right at this lateral portion, the condyle of the tib, I'm just coming off and I'm going back down. All right. So I'm getting a good strip here. And since you have so much tissue, you can do thumbs, 2 fingers, 3 fingers. And you could even do, all right. Bring it up against my pressure, okay? Now, what I do with this opposite hand, I may invert it and bring it to a dorsiflexion passively. I'll do the work, or I'll bring it up. So thumb on an island for one strip, 3 fingers, soft fist. So I just did 3 different types of the same stroke, 3 different. So I just stripped that muscle 3 different ways. Stripped it, thumb, 2 fingers, soft fist. So you have those 3 strokes, and as I come here, once I'm finishing off that, you're gonna have to probably come around. So once I finish off my treatment of the tibialis anterior, we know that that tendon comes around here, and it's at the base of his big toe. And then now I'm just, you guys might have to come and see it. You okay with this? So I feel, my palpation is I'm just feeling right about here, because if we look where it attaches, the medial cuneiforms. So remember those cuneiforms? And we have the medial cuneiform, and then at the base of that fifth tarsus. So I'm just in here. Just small circles, the size of a quarter. And that finishes my treatment. So I want you guys to put everything into perspective now, because you guys have been taught 50-minute Swedish. Now we're getting into treatment. You see, something has to get cut off. Because if you were treating just tibialis, yeah, you can go.